And of course, we always know, at least in the European Society of Cardiology, believes the score is an excellent prognostic tool on the risk of patients. I don't know if it's as good for Indian patients. That's something probably you would have local scores which could be more calibrated. It's difficult to say. What is the first part? Lifestyle recommendation. It's always important, and it is a very important part of the long-term prognosis. Pharmacological and behavioral strategies for smoking cessation helps a lot. We must avoid smoking, and especially passive smoking. Latest data show that even 3 to 5 cigarettes per day continue to maintain a risk of coronary artery disease event quite high, almost comparable to somebody who smokes 10 or 20 cigarettes per day. So we shouldn't under-evaluate regular smoking of low number of cigarettes. It continues to be a significant risk factor. A diet high in vegetable, fruit, and whole grains, we're reducing saturated fat to less than 10% and limiting alcohol to less than 100 grams a week is quite useful. 30 to 60 minutes of moderate physical activity in most days is important. Normally, when we try to give them an advice, according also to the guidelines, seems that 150 minutes per week is a very good number that helps patients. Ideally, a weight, a BMI less than 25. We know that cardiovascular risk increases significantly in a BMI more than 27. That's not always easy. Important to let people know that the lower their weight, the better it is. Diet. At least in Europe, we got a lot of data also from the PREDIMED study, the only study we had in which it was prospective and not just collecting retrospectively data, in which we show that increased consumption of fruits and vegetables, fibers, nuts, moderate consumptions, unsalted 30 grams per day, fish 1 to 2 servings a week, limit meat. We never saw in any study or in any, let's say, retrospective study that consuming meat as the main source of saturated fat, it increases events or deaths. But still, we know that people which have a more vegetable nutrition have better blood pressure and better lipids. The only food that we saw that increases significantly cardiovascular deaths is processed meat. So that's something we tell our patients to avoid to eat. That's really important. And of course, to try to reduce as little as possible transsaturated fat. It's not really easy to tell them which are the trans fats, but I would say if we tell them that processed foods practically contains trans fatty acids, and the more natural the food is, the better, the healthier it is a very good general advice. It's important to try to simplify pharmacological regimen. A lot of people are depressed, especially in combination with coronary artery disease. So psychological intervention could be useful. Rehabilitation in a special center can help them to get a healthy lifestyle. And annual influenza is always recommended, especially in the elderly. Also because we saw that influenza, if we have it, it increases the chances of an acute coronary syndrome in the next months in a significant percentage.